Exosomes are a huge trend in regenerative aesthetics, but they're nothing new. They've been around forever. That's because they actually are made in our own cells. Exosomes are little transport vesicles that are made inside a cell and then leave the cell to go to another cell. Their job is to transport messages or goods such as growth factors and other proteins to another cell. The beauty about exosomes is because of their envelope, it's what they're made of or covered in, and because of their size, they can get in and out of cells really easily. Most exosomes have spiky things on the outside called tetraspanins. That's almost like a customs label that tells the other cells what's inside it, where it came from, and where it's supposed to be going. We can harness the power of these exosomes by actually filling them up with goodies that we want to transport to our cells. We can send instructions to the cells to make collagen, elastin, high hyaluronic acid. We can make them anti-inflammatory. We can send growth factors. We can send other proteins that our cells need. Most exosomes in the UK come from either plant or animal cells. I don't believe in either of these. Human-derived exosomes are illegal in the UK, so we don't use these either. At the clinic in Skin Medical, we use a synthetic biomimetic exosome which mimics the exosome that comes from human bone marrow stem cells. So we know that they've got a huge healing potential, which means they're pro-regenerative, and they're also really anti-inflammatory. We've also started using some bacterial exosomes which help to improve the skin barrier and the skin barrier function. The way to deliver these exosomes is by needling them into the skin. We can use exosomes on their own as a standalone treatment, or we can use them to really upscale other treatments, such as when I combine them with needling radiofrequency. That's called treatment stacking. Exosomes are a really great step forward in regenerative aesthetics, but it's really important to know which exosomes they are, what they do, and why we're using them.